Hello everyone. This video will showcase what to expect from your first pelvic floor appointment. Very exciting stuff. I want to create a space where you feel excited, where you feel empowered, where you get to know your body and rediscover your inner self. I want to get to know you. I want to hear your story. I want to help you connect the different dots of where your symptoms are coming from and help you explore what are potential contributors that are present that maybe you didn't even think about. How do I do that? I combine pelvic floor physiotherapy and knowledge from functional medicine to help to piece the different puzzle pieces that are a part of your experience. And what do? We start with the story. Storytelling really is going to help to set up the stage to find out the different pieces that are contributing to how we got to today and you're seeing me. I want to know what had happened, when it happened, any previous experiences that you have had, and what really had led you to come and see me. We move into more specific pelvic floor questions to find out about your bladder, your bowels, your menstruation, sexual health as well. And please be advised, you can share whatever information you want to share with me. I know talking about pelvic floors can feel uncomfortable and scary at times, so don't feel like there's a pressure coming from me. Think about us working in a team setting where we're trying to work on a problem together, or rather explore something together than fixing a problem. We then jump into the pillars of health, where I want to take a look at the broader picture of your lifestyle and find more about your diet, hydration, what do you do for work? What do you like to do on your spare time? How do you identify in this world? I also want to get to know how are you feeling? Where's your mental and emotional state? How is your stress? As well as explore other pieces that are related to your life. We then move into more past medical history. Are you taking any medications, vitamins, or have had other injuries in the past? No such thing as not important information. Share with me anything. Oftentimes it is somehow related and interconnected to what you are experiencing. We go into your expectations. What do you want to achieve, not just from the first session, but for the next following up sessions, and just in general, how can I support you? Think about those things. I think it's really going to help to set up the stage also for what goals you want to achieve, and thinking a little bit outside the box. What really would be awesome to do or feel? I don't want you to feel like you're stuck because of your experience. I really want you to think big and feel like we can really reach those places together. Then from there, we also want to explore your capacity. Are there any barriers in life? Finances, are they playing a role in attending sessions? Your location, maybe we're far away and we need to do virtual sessions. Childcare, how life is it busy? How is work? So all of those things should factor in terms of our plan. And I want to know all of those things, and please share what you feel comfortable sharing with me as well. So again, there's no pressure. And so if there are any other worries or concerns, you please share that with me. And so from that, is really helping us to set up the stage for our next portion of the assessment. In addition to that, it also helps me to start personalize the plan for you. Now, I often give the option of an educational piece about the pelvic floors, how they work, how they're interconnected with your story. So it's very personalized to you. I find it really just helps to set up the stage for the physical portion of, or the movement portion of the assessment. Now, what do we do for the movement portion of the assessment? Oftentimes people think, oh, we just do a pelvic floor assessment and that's it. Well, actually, no. The rest of the body is well interconnected with the pelvic floors. And so I like to look at the body as a whole. I want to start out with a movement assessment. How are you carrying yourself in life? How is your posture? How are you breathing? Spoiler alert, it really connects deeply with the pelvic floor. So we'll chat about that soon in next videos as well. We move into how your rib cage is moving. How is your spine moving? Your hips, your ankles, your jaw, and how your core is firing as well. So you can see there's many different components to the assessment of the whole body. Again, to build up that awareness, to build a connection to the pelvic floors. A pelvic floor exam is not mandatory. I always give out that option for any individual that comes in. We have many different options if you are feeling not comfortable doing the exam, either on first time, you need time to think about it, or you feel like, yep, I don't want to do a pelvic floor exam ever. If you are interested in a pelvic floor exam, I have a separate video that goes through all the details, and I will be showing you as well what it would look like on the pelvic model, as well as go over positioning. So if you're interested in that, please click on the video that goes over the pelvic floor internal exam. Combining the chatty part and the movement part, we come up with a plan that's personalized to you, that is fitting for the first assessment or the first session together. Oftentimes it needs to be tweaked based off of your life, because life is not static and can be unpredictable. Things come up, and that's okay. We go with the flow. We go with how you are doing, and I find that really helps in terms of setting up the stage and achieving your goals, rather than feel like you cannot get to where you really want to be at. Treatment is also quite personalized to you. We go over a lot of education and implement specific exercises that are pertained to your symptoms and pertain to our assessments as well as your needs. I like to make it efficient and realistic to your day and the season that you are in. And usually I give the exercises in a video format, and when I stay connected through email as well. Now, throughout the assessment, ask me anything. Really, interrupt me if any thoughts come to mind. Please make sure to just bring them up. We're just having a conversation, really. It's a great way for us to connect, for you to build up that awareness as well. And so the story evolves as the treatment does as well. My goal is for you to get to know your body, your core, and your pelvic floors. Feel confident that you can do anything, and not let anything stop you, and do what your heart really desires. Now what? If you're not sure if pelvic floor physiotherapy is for you, well, we can always book a phone or a video 15-minute complimentary call to have a discussion in terms of where you're at, what are you experiencing, to be sure that A, we're a good match, and B, that pelvic floor may be a really good option for you as well. And so if you already have an appointment, then it's fantastic. Then I look forward to meeting and working with you. But I think this video will just give you a nice viewpoint as to what you expect from your first pelvic floor appointment.